So I'm going to just start our presentation off with a little bit about how farm worker advocates, farm worker organizations are A, getting their information, and B, feeling about the situation with farm workers and COVID-19. So let me see if I can get my slides to move forward here. Okay, let's see if this will work. So I'm hoping that you couldn't keep up with that because I can't. And literally we are dependent on the media to help us understand across the country what is happening with our agricultural workers, the number of infections, the number of deaths. And as we have seen from the news, that the essential workers, those working in agriculture, those processing our seafood, our meat, and our chicken, they are all deemed essential workers during COVID-19, and they are bearing a large portion of the risk. And I don't have precise numbers for you right now for farm workers, but we do know that hundreds have been infected with COVID-19. And from my understanding, there's been a handful of deaths, although we don't have a really great system of surveillance in place to record those deaths. And that kind of reflects some of our challenges in surveillance in agriculture in general. The vulnerabilities for these population of essential workers are multifaceted. They're long-standing. They're not particular to COVID-19 per se. We have cultural and language differences to start. The inherent dangers of the risk of the occupation. Agriculture is an extremely dangerous occupation. It's often a low-wage job. Immigration is a really important component, and what the workers' immigration status is. With some research that we did at UMASH a couple of years ago, we documented that if you do not have authorization to work legally in the United States, that puts you at risk on the job. And then many of our farm workers, not all, are moving from place to place. Some are stationary, some are not. But when you are moving from place to place, it adds to your vulnerability. And many of our farm workers do not have access to health care. They do not have access to insurance, even if they wanted it, although some do. And many lack the financial resources to get health care. And then I think it's always important when talking about the vulnerabilities in agriculture to recognize that most of our agricultural workers have different types of protections, weaker protections than other workers in other industries. And all this whole list here sort of fall into the different types of vulnerabilities that put the farm workers and agricultural workers more at risk. And so with the fact that we have farm workers who are essential workers, and given the vulnerabilities that I talked about, and given the fact that many of our farm workers are from communities of color, immigrant, Latinx and African American, Haitian Creole speaking workers, we are not surprised that the communities of color in our country are most impacted disproportionately by COVID-19. If you are Black in this country, Black people are dying at 2.5 times the rate of white people, and Latinx are twice as likely as whites to get infected by COVID-19. I think it's really important. I listed some of the vulnerabilities. Those vulnerabilities are important to think about during COVID-19, as well as before and after COVID-19, but also many of the risks that further the concerns for COVID-19 are pre-COVID and during COVID. So that crowded housing, transportation, ongoing pesticide and chemical exposure, injuries, and regulations. I know I'm repeating a little bit, but my point is that some of these concerns are relevant to a worker's safety during COVID-19, particularly the crowded housing and the transportation piece of it. Many workers, like the worker pictured here, live in small rooms with bunk beds where it's impossible to be physically distanced from your other workers. There's communal space that's shared for bathrooms and for eating. So there's a lot of challenges on a regular day, but given the infectivity of COVID-19, it makes it super challenging for our farm workers. And an interesting study came out specific to farm workers. This is a preprint study from July of 2020, but I think it's important to mention here that these researchers, they looked at social determinants of health and COVID-19 mortality, and they looked at counties across the US and did all kinds of modeling, and they basically found that counties with more non-English speaking households and more farm workers had significantly higher levels of mortality, as did counties with higher levels of poverty and more residents over the age of 65. Why is this so important? Because it specifically underscores occupation when we're looking at COVID-19 and occupation as a social determinant of health. Another challenge that we're looking at and we're facing in this pandemic is the urge, the not surprising, but the blame that workers are experiencing. And many are saying, oh, it's their home and social conditions that are causing the outbreaks in the meatpacking plants. One politician even said, like, the living circumstances of certain cultures. The governor of Florida said they go to work in school buses and they're all packed in there like sardines. Some of these are indeed true. They are in crowded housing. They do have crowded transportation, but the way that it's often been framed is that it's the fault of the workers for contracting COVID-19, when it's really important for us to understand that it is not the fault of our workers at all. They are putting the food on our table, and it's these structural challenges that we have in terms of their ongoing conditions that put them further at risk. But the very nature of their work, whether they're in close quarters in a poultry plant, whether they're in close quarters while they're picking crabs, whether in close quarters while they're sleeping in their labor camps during the agricultural season, that is what is putting them at risk, is that their inability to be physically distant from each other and the very nature of the work. And I think this is really important to sort of bring to any discussion. I know we're not having farm workers speak here, but I think this is a really great quote from a farm worker. His name is Gerardo Reyes Chavez. He's from the Coalition of Unlawfully Workers. And his point is, like, you hear the job that we do is essential, but you realize as a worker, you're not treated as essential. You're often treated as dispensable. So with that in mind, I know that farm worker advocates, healthcare organizations, organizations like UMASH, anyone sort of concerned or trying to address the health and safety of our agricultural workers has a lot of work to do to establish the community trust so that we can begin to help them protect themselves or be protected from the COVID-19 pandemic and being infected from and becoming sick. And here's a really great model in Wisconsin, part of the upper Midwest Agricultural Safety and Health Center geographic region in Wisconsin. And this is just a photo of La Clinica. They are one of the only migrant health providers in the state of Wisconsin. And they, together with a coalition of other folks, really worked hard as soon as they recognized what was happening with other, as soon as they recognized, as many of us did, that farm workers were going to be incredibly vulnerable. And they have put together just a wonderful set of guidelines that help healthcare providers charge into gear when workers arrive, and they work with the farmers, they work with the workers, they're doing testing, they have a whole risk mitigation strategy. And I don't know, Megan, or if Kate is able to, if you can go ahead and paste into the chat box the blogs that MCN wrote about Wisconsin and some of their efforts that have been really important in this pandemic. MCN has talked to a lot of health centers and community organizations across the country, trying to share with them the best practices that are occurring. Let's see.
Hi, Amy, this is Kate. I just put them in there.
Great, thank you so much, Kate. So it looks like they're kind of close together. It looks like we have 2 blogs put in. But one of the blogs talks about some great outreach efforts, and the other blog talks about, but they both talk about some different clinical practices as well. This is a photo right here of Dr. Eva Galvez. She's on MCN's board of directors. She's also a physician at the Virginia Garcia Health Center in Oregon, and she has done an outstanding job, just like the folks in Wisconsin, in terms of getting out there, helping farmers, helping workers, testing workers, doing the contact tracing. But what she has underscored, and what's I think important for us to understand, and I think one of the reasons Wisconsin's been successful as well, is that she firsthand is seeing the impact of what happens to workers when there aren't sufficient regulations in place, and when the workplaces are unprepared. And that is something that we are finding across the country, is that when farmers and agricultural industry and health centers and health departments partner together to help test, to help come up with a strategy of what you do with positive workers, to help make sure that there are both quarantine and isolation protocols in place, make sure that workers are paid if they are unable to work, and that food is supplied to them. There is the possibility that we can be successful in continuing to harvest our food and try to minimize the risk that workers face. And so I think that there's a combination of both that local effort with various partners, including the workers, their families, and employers, along with the other institutions that are really critical in making sure that health and safety is addressed, and that includes our local health departments, that includes our local health centers, and coming together to be able to sort of help workers and farmers come up with a plan so that they can help the folks that to prevent COVID-19 infection, as well as address any outbreaks. I just want to, so we stuck this couple of blogs, the links in the chat box, but I also want to take you to our virtual Expo booth, and we have a lot of really great resources that are relevant for farm worker and agricultural worker health and safety on any given day, regardless of COVID-19, and then visit our website as well as our blogs. I really encourage you all to sign up for MCN's blogs, because we do provide up-to-date information about what's happening in the field, offering best practices, sharing guidelines, and sharing the best of our knowledge, the best clinical practices as well. And that's at migrantclinician.org. But back to our expo, I also want to point out that together with the Upper Midwest Agricultural Safety and Health Center and MCN and the National Farm Medicine Center, we've been doing a lot of great work over the last 5 years and during this 5-year cycle to work with immigrant dairy workers. And so on the expo page, as well as on the Migrant Clinicians Network website, as well as on UMASH's website, you can access some really great worker health and safety curriculum particular to both, farm workers dealing with crop agriculture, as well as for workers who are working in dairies. And while many of these resources were developed and are continuing to be distributed during the COVID-19 pandemic, there are a lot of best practices, particularly around hygiene, that are emphasized in many of these resources. And so I think even if you don't, some of these resources are relevant regardless, and I encourage you to take a look at them and hopefully use them. So that's all I have for my presentation. I'll stop sharing my screen and see if we have any questions.
That was fantastic. Thank you for being here today, Amy. It's always important from UMASH's perspective, and I think for agriculture in general, to have the champions that we do for agricultural workers, and we really appreciate the work that MCN does, especially in collaboration with UMASH. So any questions, people can pop into the Q&A at this point, and I'm going to kick it off with one. So Amy, you talked about a number of places that people can go for information, whether it be your blog, your website. We also dropped the link for your Expo booth down in the chat. What other calls to actions or things would you like folks to do following this presentation today?
Well, I think that there are a number of states working really hard to put together some regulations or executive orders, temporary executive orders, to help address some of the challenges and to assist with worker protection. And I think what we're seeing by and large, not in every case, but when you have that local community participation with health centers and health departments that coincide with an executive order or a regulation, that is actually really important in helping for a successful intervention dealing with COVID-19. It's very hard when those regulations are not in place. And just as a great example, as we were doing a lot of our immigrant dairy work in Wisconsin, there just happened to be, because it's so dangerous, a local emphasis program at that time from OSHA. And what we found, and that meant that OSHA was going to be taking a harder look at dairy farms and helping dairy farms with protective practices. And what we found is that OSHA wasn't out there citing farms. What we found is that agricultural producers were contacting the National Farm Medicine Center and UMASH and asking, what is it that we need to do to comply with these regulations and be safe? And so that really gave us a really wonderful entree onto farms, where we were able to do a partnership that was outside of government with the producer, with the workers, that involved an extensive training for the workers, which was part of what OSHA wanted to have happen, and also work with the producers to help them with policies and protocols to help them minimize some of the hazards that workers didn't have control over. So making sure that there were, clearly marked signs, making sure that there were protocols for how you worked in confined spaces, making sure that there was training available, all those things. So regulations didn't make or break this, but they were super important to have in conjunction, because they offered a framework, and farmers and producers wanted to comply with them. And we had a program that we were able to go onto the farm and help them and ultimately achieve our goal, which was to keep workers safe and healthy on the farm.
Yeah, that's a great response. One other question that I would be great right now is there anything do you want to talk a little bit about the Promoting Worker Health project and give any context about that and how folks might be able to learn more about it or get involved?
Sure, that's a great question. So I've mentioned a couple of times that we have these really wonderful NIOSH funded projects as part of the Upper Midwest Agricultural Safety and Health Center. And, we have been working for like 9 years, pretty much, both in Wisconsin and Minnesota. And right now we have a project about protecting workers in Minnesota, where we're applying a lot of the resources, the lessons learned, the content to some of our farms in Minnesota. And that project, like I mentioned, is a project that involves a partnership with the producers, where we are able to go to the farms and implement a 5-module bilingual train the trainer curriculum. And it's really important that we have spent a lot of time talking to producers, talking to health and safety experts, talking to occupational medicine specialists, talking to workers and getting their input. So our curriculum has been vetted, tested, piloted with the input of all of those folks that have various types of expertise and really important expertise, from the worker to the producer to the safety professional. And we have put them into a curriculum that is appropriate for the language that many workers speak. We have put it in a context so that the literacy level is appropriate. We have supporting resources that recognize the limited formal education that workers have. So all of those resources are available on the MCN Expo booth, as well as on the UMASH webpage, as well as on the MCN webpage. So I encourage you to take a look at those resources, and they're there for your use.
Perfect. Thanks, Amy. And the final question comes from Monica. She says, thank you, Amy. Could you talk a little more about workers' attitudes and cultural perceptions towards COVID-19? How often do you find workers that do not believe COVID-19 is a threat to them?
No, we are hearing lots of anecdotes, but we are not hearing from workers that they feel that COVID-19 is not a threat to them. That is not at all what we're hearing. What we're hearing is that workers are scared. That is I think the biggest take-home piece that we're hearing from some initial research that we're doing, as well as just talking to workers or talking to those who are working with workers. They're scared. They're scared mostly that not only will they get infected, but they're scared about going to work and coming home and infecting their family members. That is what their biggest fear is. So I think that we have been challenged, every single one of us who works in public health, who works in agricultural health and safety, we have been challenged from the start of this pandemic with just being overrun by misinformation, by myths. And so that has made our job challenging, but has also showed us the importance of continuing to provide information from a trusted source, building that community trust so that you can maintain that trust, and providing fact-based, evidence-based information. When you look at COVID-19, it is not rocket science. It is a highly infectious disease. We know what we do. We know what to do. The challenges are that the science has been emerging, so there's a need to rapidly get some of the information to people, so that our job is continuous. It's not a one-shot deal where you develop a resource and you're done. Some of the recommendations that we made in March have changed. If you just look at the trajectory of what happened when we were, disinfecting every single surface and washing our hands, thousands of times a day, while that is still important, we now recognize the airborne transmission of this disease. And so we're wearing masks, we're understanding the importance for physical distancing. And so getting that out, explaining that it's going to change, recognizing the change, and having that information reinforced in a language and in a way that workers understand, and having it be provided by a trusted source is critical. At MCN and with the National Farm Medicine Center and with the UMASH, we've tried to build a community health worker program in which we're training workers to be able to provide and be a translator, not like in language, but a translator of that information to their coworkers. And that's an effort that is still needed and needs to continue.
Great, thank you, Amy. And then one other question, and we'll need a quick response on this one, but how have public-private partnerships with MCN been a part of the routine work during the pandemic?
Public-private partnerships. So I think that partnerships, I don't know if we want to say public, I'm not sure like, you know, what we consider private in this conversation, but I think that the partnerships, and if you look at, you know, producers being private, if you look at industry or you know, certain non-profit organizations being private, absolutely, it has taken a village and you know, programs that are federally funded, that are state funded, working in conjunction with industry, with local health departments and health centers. So some of those, all of those different, except for local health departments probably, all of those different groups have a mix of federal, private and public funding. But some of the entities I think you can say are clearly more private than public, and they have been critical to partnerships.